So what I'm hoping to do over the next 15 minutes or so is just touch on some of the work that I've conducted and some of the international literature around systems maps, and really kind of give a bit of a flavour in terms of how it could potentially be, or how they could be potentially used to explore the system of sustainable transport in Waterford, but more specifically, how systems maps can be used then to identify some solutions that exist within the system for young people. So just a little bit about me. I'm a PhD student in WIT, same as Katrina, and my PhD is co-funded by Get Ireland Walking and by WIT. For those of you who are aware of Get Ireland Walking and what they do, they're a national organisation with the kind of overall vision of creating a culture of walking in Ireland. So, kind of written on paper, it's a fairly simple vision, but it's a really, really complex problem. And this idea of addressing complex problems and how we approach and address them is something that I'm hoping to touch on throughout the next 15 minutes or so. So what I'm hoping to touch on over the course of the presentation really is just give a bit of an insight into what it could potentially mean to think in a systems-based way and ultimately approach the problem of sustainable transport and other complex problems from a systems perspective, and then give an insight into how we can visualize them and conceptualize these problems through systems maps. So I'll illustrate my point then through some international examples from the literature, and then some of the work that I conducted myself in County Cork here in Ireland. And finally, I'm just going to leave you with some learnings that I feel Waterford could take on board if it was something that they were to pursue in terms of developing a systems map for walking or cycling in Waterford. So we might start with just the problem of walking in particular. I'm going to go back a slide there. They're jumping. So walking is something that's made up of a lot of different factors in terms of there's lots of different things at play when we talk about how much people walk. And these factors kind of exist at different levels of the system, kind of individual level factors like biology and psychology, all the way up to geographic factors, how hilly is an area, how close do people live to the shops, pharmacy, etc. And then infrastructure is another factor. So all of these are kind of factors that are at play when we talk about how much people walk. And the traditional way in which we would have approached these problems through research is quite a linear way. And the way that they appear on that slide there in terms of each factor is separate and they're not connected or related to each other is kind of the way we traditionally would have approached it. So I'll use the example of raw spaghetti to kind of illustrate my point of our traditional way of viewing and approaching our problems, insofar as that our traditional lens that we viewed our problems were quite linear, and we really employed a cause and effect type model, and we worked in our silos to address these problems, and we took out each individual strand of spaghetti, each factor that influences a problem, and analysed it to within an inch of its life, and not really took into consideration that it's the whole packet of spaghetti, the whole system that creates a problem. And we now know that this way of looking at our problems, this way of researching complex problems such as obesity, physical activity, isn't working. If we look at physical activity specifically, the amount of money and funding that has gone into physical activity research over the last 30 or so years has gone up, but we haven't really seen the population level behavior change that would reflect the amount of money and the amount of effort we pumped into it. So researchers now are calling on a new way of looking at our problems and a new way of approaching these problems, and they're called systems approaches. So let's take into consideration the same problem, walking, same factors, but let's start acknowledging that in some way, shape or form, whether empirically or theoretically, that some of the factors are interdependent and interconnected. And not only that, but the organizations who work within this system on these factors, their work, their policies, their strategies are interrelated. And the whole premise of a systems approach is that it takes effort from all areas of the system to see sustained change. So rather than looking at a problem as raw spaghetti, the way a problem could be conceptualized through a systems lens would be as cooked spaghetti. So rather than talking about the analysis of and really trying to gain the most robust scientific evidence for each individual factor, it's about synthesizing what we have and the interconnectedness of the factors and the relationships between organizations and between factors that that add up to a problem, and the networks of organizations within the system. So it's a little bit of a more messy look at the problem, but I think some of you will agree it's probably more of a realistic view on how these problems actually manifest themselves in reality. So researchers are now taking this way of looking at problems, and they're left with the kind of first step of how do they make sense of it, and what do they do to make sense of it. Well, systems maps is where come in here in terms of how they are used to visualize and conceptualize problems. And I'm just going to pull up some examples of systems maps here. So this is an example of for a systems map for physical activity at the local level in England. There's an example for obesity at the local level in Australia. There's another example of physical activity more broadly at the conceptual level. And then finally, there's an example of obesity, which was developed by Foresight. And this is kind of the jewel in the systems map crown, really. It's very, very complex and it's very overwhelming upon first look. And it kind of looks like that bowl of spaghetti that I had a couple of slides ago. But what these systems maps are is that they're a product of discussions between interdisciplinary stakeholders who work on a particular problem. So if we take the problem of this particular one here, which was physical activity for the local level in England, who would be involved in that, or who was involved in this study and the development of this map, were the usual suspects if you think about physical activity promotion at the local level. So the equivalent of the local sports partnerships in that area, the local authorities. But really, to get a holistic perspective on the system of physical activity, the researchers who developed this particular map started to identify stakeholders who may have an indirect role in the promotion of physical activity. So that might be planners, developers, people who work in urban design. And the purpose of these discussions is not really to develop the map itself. The mapping process is the catalyst and is the important part. And they're not arts and crafts activities. The purpose of these types of systems maps is actually to identify actionable outcomes for the system to take on board. So if we talk about identifying gaps, this particular systems map and the discussions that took place around data and evidence, the stakeholders themselves were able to identify areas within the system that there was data existing, whether it was through programs or whether it was through footfall counts, but they were also able to identify areas within the system of physical activity in that local area that needed more data. And as well as that, the stakeholders themselves could kind of pick out where they fit within that systems map as well. So it's a really iterative, dynamic process, but it allows stakeholders to kind of gain a new perspective. So those were examples of the international literature and some of the work that's been done abroad in relation to developing systems maps for public health problems. But what I did over the summer was developed one of these maps for walking in County Cork. So when I started off this research project, I'm going to start off with an empty table, and I'm thinking about who should be involved in a conversation about the system of walking in Cork. And as I mentioned for the last slide, the usual suspects will have to be there in terms of the local sports partnerships, the local authorities, researchers, those of you you would think have a direct role to play in the promotion of physical activity or the promotion of walking or in the walking system in my case. But to really get a holistic perspective, we started to identify those who might have an indirect role to play, such as tourism, those who work in healthcare, disability organisations, and those individuals came together over the course of 2 online workshops and 5 semi-structured interviews to develop this iteration of the systems map that you can see on the slide here. And as I mentioned, it wasn't the purposes of my research wasn't to develop the map. It was actually to identify some solutions to problems that existed within that particular system. And over the course of the 2 workshops and over the course of the 5 interviews, there were 19 different solutions that were identified by the stakeholders themselves that existed within that particular system. And there were 2 kind of arms to those solutions, and two priority areas or leverage points, we've called them. One of them was how organizations communicate between each other and also within organizations as well. So communication was one leverage point, and a second leverage point was data and evidence, and how data and evidence is collected but also used in the system of walking in Cork. And I might just flag one thing on that issue of data and evidence. I suspect that if something like this was to be developed for walking in Waterford, or cycling for that matter, data and evidence could potentially be an issue that could pop up. And something that I'm working on at the moment that I'd be happy to speak with anyone who's interested afterwards is I'm working on a piece of work now that's collating any existing evidence in relation to monitoring walking or mobility from multiple different sources that could be of benefit to local authorities in terms of monitoring the movement of through urban areas, etc. So we're using data sources like footfall counters, public Wi-Fi networks, and kind of more big data stuff then, like phone network data and stuff like that. So there is an abundance of data out there, and I just wanted to flag that as well, if anyone here was interested in maybe discussing that further after. So I suppose, what learnings can I offer from my own work, and then ultimately what's any systems that have been developed so far for Waterford? The pieces on the right hand side of that diagram are kind of the big ones for me. The ability for a systems map, and ultimately the systems mapping process, to allow stakeholders to gain a new perspective on the problem that they're working on, and ultimately where they fit within this big complex system, this big messy bowl of spaghetti, to be able to say whose work overlaps with theirs, what resources can they contribute to the system, how can they help, and ultimately the ability for a systems mapping workshop and a process that I went through to be able to identify context-specific solutions for Waterford is something that I feel is a real benefit here. And then logistically, these workshops would be traditionally kind of done in person, and they might go over the course of a day or maybe 2 half days, but I had to amend my approach because of COVID, and we held the workshops online. And I feel like with enough support from facilitators and enough effort gone into structuring the workshop and really tailoring the questions that you're asking of the stakeholders, online workshops can do the job in terms of acting as a catalyst to bring these interdisciplinary stakeholders together who might not necessarily work with each other. And a big one as well is you don't have to start from scratch with these. You can take a systems map that's been developed before and just apply it to the Waterford context. And that's exactly what I did in County Cork. I picked up a map that was developed for physical activity in Australia and applied it to the Cork context. So you don't have to start from scratch when you are developing these types of systems maps. So really, just to conclude, if the systems mapping exercise and looking at the problem of sustainable transport as a system was something that was going to be taken on board in Waterford, acknowledging the complexity of the problem is the first step, but also embracing the complexity of it as well. And the first step in embracing the complexity would be to engage with these stakeholders who kind of are those indirect roles in the system, and thinking outside the box in terms of who should be sitting around that table. But just to tie it back to the purposes of today's event, if we're really trying to focus on the young people and their problems in engaging with cycling or walking within the system in Waterford, yes, the usual suspects should be there in terms of the local sports partnerships, the local authorities. But if we really want to get the young people's perspective, they have to be at the top of the table and they need to be involved in the process. Thank you.